you decided to get in shape, so you started running and you're leaking urine. You have to wear pads. It's so frustrating, and it's just not fair because you're trying to be healthy, but you're being held back by your bladder. Or you're sneezing and coughing, it's allergy season, and you're leaking everywhere. What are you supposed to do? You've worked on Kegels. What is the next step? Well, in this video, I'm going to tell you 4 wonderful solutions for stress urinary incontinence. And we're going to dive right in, and I'm going to help you figure out which solution is best for you. If you like my channel, please subscribe, and don't forget to hit the bell down below so that you'll be notified each time I post a new video each week. All right, well, let's go right into different treatment options for stress urinary incontinence. So just a brief reminder, stress urinary incontinence is leakage with cough, sneeze, exercise, jump on the trampoline, sometimes laugh, sometimes with sex, and the urine involuntarily comes out because of that sudden force of pressure on the bladder. I have another video which you can see in the links below where I go into all about stress urinary incontinence and give you some more good information about that. Today we're going to be focused on the treatment. So, number 1, the first treatment option after you've done everything you can at home is the new EMSella chair. And I'm going in order from least invasive to most invasive. So the new EMSella chair is an incredible breakthrough technology using electromagnetic energy to tone and tighten the muscles around the bladder and urethra so that you can hold the urine in better. You sit on the chair fully clothed, and it will do 28,000 Kegels exercises for you in 28 minutes. 11,000 Kegels exercises in 28 minutes. It doesn't hurt, and it is quite effective. The vast majority of my patients are noticing a big improvement after the course of treatment, which is 2 treatments per week for 3 weeks. So that's number 1. Number 2, pelvic floor muscle toning. So pelvic floor muscle toning involves a vaginal probe and a rectal probe. So one of my assistants will administer this treatment to you, and the rectal probe is there to measure your Kegels and coach you through the Kegels. I often call this like a personal trainer for your bladder. So she will coach you, she'll measure the intensity of your Kegels exercise and be able to show you on a graph, and then be able to tailor your Kegels program at home to what is found on there. So you want to make sure that you're holding the Kegels muscle properly, squeezing it properly to the right degree, not too much, not too little. The second part of the pelvic floor muscle toning or Kegels coaching is she takes out the probe from the rectum, and the vaginal probe has electrical stimulation to stimulate the muscles and nerves of the pelvic floor. Again, this is very effective in the vast majority of patients, and it can also help if you're having, in addition to stress incontinence, overactive bladder symptoms, having to wake up at night to go to the bathroom. So a very effective and easy treatment. So usually approximately 6 treatments spread out over 6 weeks. Sometimes we'll go 8 or 12 just depending on the patient. And each treatment's about 20 minutes. Okay, number 3. Number 3 is Thermiva, which is also a vaginal treatment. And this uses radiofrequency energy to build up the collagen and tissue around the urethra and bladder. So it is especially good if, in addition to stress incontinence, if you feel like your vagina is too loose or intercourse is painful or dry, you'll get a double benefit from Thermiva. It's an office-based procedure. It is painless. It takes about 30 minutes, and warm heat is administered through a lubricated wand, which is about the size of a finger, and it heats up the tissue. So it warms it up so that the fibrocytes that are dormant become fibroblasts and start to again lay down new collagen, elastin, and blood flow so that the vaginal walls and the area under the urethra will then function normally again. Okay, number 4, the 4th treatment for stress urinary incontinence is surgery. And the surgery that is most commonly done for this condition is called a sling. A sling is a minimally invasive procedure. It has been done for decades in various forms, and for the past 20 years, the gold standard treatment is the polypropylene or synthetic sling. It has been out now since around 1999, 1997, around that time frame is when it first came out. And we have mountains and mountains of data showing how effective and safe it is. I have done thousands of these procedures with great success, very happy patients. It's a minimally invasive surgery. It doesn't take very long, maybe 15-20 minutes. You go home the same day, and then you just rest and take care of your body while you're healing. The downtime is very minimal. So a sling is a wonderful option. There is, in addition to the synthetic sling, a sling can be made with more natural materials. So I can actually take your own body wall to make the sling, and I can also use fetal calf skin, which is processed to make a strong sheet of collagen, which will then be used under the urethra to provide the support that you need. I like the synthetic sling a little better because it's tension-free, so the chance of making it too tight is lessened than with the other two procedures with the natural tissues. So the chance of needing a catheter afterwards is decreased with the synthetic sling. So those are the 4 treatment options for stress urinary incontinence: the EMSella chair, the pelvic floor muscle toning or Kegel's coaching, the Thermiva, and the sling. I'm proud that we offer all these in our office, and we'd love to see you and give you a consultation. In addition, I am offering you a free downloadable guide to my 8 top bladder health tips. So this is going to really help you do everything you can at home to optimize your bladder health and take good care of your bladder, because leakage is a big issue. It's a lifestyle issue, and as we get older, it's one of the main reasons that patients end up in a nursing home. Their family can no longer care for their diaper needs. So take care of your bladder. So if you look at the link below, you'll see a place where you can click and download my free guide, and I think it'll help you a lot. I am here to give you free advice and free information that can help you understand your body better, and I am going to try to give you new information every week to help you out. I hope you'll subscribe to my channel, click on the little bell next to it so you'll know when I release a new video. And then if you like this video, give me a thumbs up. If you didn't like it, feel free to give me a thumbs down. I learn from either way. And comment if you have questions. I'll try to answer your questions. I do have an info line on my website that is in the text below, so you can ask me a confidential question. And please share this if you know somebody, maybe your mother or your sister, that could use this information. All right, well, you take care and have a great day, and God bless you so much. Bye-bye.